Hello, everyone. Welcome to Focus for Sight TV, a hub for things eye care. I'm Dr. Bashir, and today we have a special guest here who is going to walk us through some of the important roles of an optometrist. Please help me welcome Dr. Felix Oyeki.
Thank you very
Dr.
much.
Felix, you're welcome.
Thank you.
All right, so Dr. Felix is an experienced optometrist with so much expertise in the field. Dr. Felix, can you briefly tell us a bit about yourself and your background in optometry?
Okay, thank you very much. My name is Dr. Felix Kofi Auriki, as you rightly heard,
Yeah.
and I graduated the Doctor of Optometry degree program
Okay.
in 2013.
Wow.
I'm an optometrist with 10 years of experience.
Wow.
Yes, in this country.
Okay.
Yes, and I'm passionate about this profession because
Okay.
it's a noble profession.
Wow.
Because to give sight to people
Yeah.
so that they don't live in blindness,
Mhm.
I believe it's a precious area
Yeah.
and a precious profession.
Yeah.
Yes, whereby you make impact in the vision and eye of people so that
Wow.
they can see, to be able to work, to be able to school, to be able to do whatever they want to do. Because without eyesight, I believe that life becomes very unbearable
Yeah, that's very
and
true.
challenging. Yeah.
Yeah. Okay, so let's dive quickly into the roles of an optometrist. So, Dr. Felix, can you walk us through some of the key responsibilities of an optometrist?
An optometrist engages in comprehensive eye examination
Okay.
and diagnose diseases of the eye and
Okay.
manages diseases of the eye,
Okay.
basically.
Okay.
Yes, though there are extensive areas
Okay.
that I believe that we'll delve in this dialogue.
Yeah.
Yes, we are engaged in comprehensive eye examination
Okay.
and management of eye diseases as
Okay.
well. Yeah.
All right. That's great. So speaking about comprehensive eye examination, what are some of these exams we perform for our patients? Are there any specialties in the field of optometry that you would like to, enlighten us on?
Great. In the cadence of eye care,
Okay.
optometrists are the primary eye care providers. They are
Okay.
the first to see when you have an eye challenge or an eye problem
Okay.
in the cadence of eye care
Okay.
or eye professionals. Yes. And when we talk about specialties in optometry or eye care with relation to optometrists, we have pediatric
Okay.
optometry practice,
Okay.
we have contact lens,
Okay.
we have low vision
Okay.
and rehabilitation, we have even sports vision,
Okay.
and then we have people who are also into research,
Oh, wow.
and then we have vision therapy, optotics,
Okay.
and vision therapy.
Okay.
Yes.
Well, these are some special fields that you just mentioned to us, and somebody might want to volunteer to practice in any of these field.
Yeah.
Okay, what do you think should guide a person's course or decision in specialty in optometry?
Yes. Good. So first and foremost, before you can branch into this any of these specializations, which is contact lens, geriatrics, pediatrics, low vision and rehabilitation,
Hmm.
or orthoptics, or any of these areas, sports vision, etc., you have to first and foremost be an optometrist.
Okay.
First and foremost. And an optometry program is 6 years in this country.
Yeah.
Yes. In other countries like US, you do 4 years basic science degree,
Okay.
then you do 4 years in optometry.
Okay.
But in Africa and Ghana, for that matter, we have 6 years of Doctor of Optometry
Okay.
degree. So afterwards, if your passion is for children, you go into pediatric optometry.
Okay.
If your passion is for the aged, then you go into geriatric optometry practice.
Yeah, that's
If
true.
your passion is into contact lens, then you go into contact lens practice.
Okay.
And then contact lens is actually evolving, it's becoming quite common in this generation,
Yeah.
and it's a plus.
Wow,
Yes. So
that's
passion.
that's great. So can you enlighten us more on some roles of optometry aside performing comprehensive eye exam? What other thing about optometry is so unique outside there that you would want to enlighten us on?
Yes. Currently, as we understand, Ghana is second in the glaucoma league table.
Okay,
Yes, and Barbados is number one.
that's very true.
Yes, and to be second on the glaucoma league table is bad because glaucoma can lead to irreversible
That's
blindness,
very true.
and so we manage glaucoma. Actually, we screen. Most of our outreaches is geared towards fishing out conditions. If you realize, we optometrists love to go out to the community
Okay.
because when you reach out to the community, then you can be able to fish out some critical conditions.
Okay.
Because for Ghana to be number two in the world, that means that most people do not examine their eye. Most people wait until there is a problem before they visit their optometrist, for that matter, their eye doctor.
Okay.
So we go out to screen so that we can fish out some of these conditions like glaucoma, for
Yeah.
example.
Yeah.
And once it's detected, we manage these conditions by monitoring the intraocular pressure and
Okay.
recommending medications if the pressures are high
Okay.
to sustain, to make sure we prevent the pressure from going overboard to affect the optic nerve so that we can preserve vision and avoid blindness due to glaucoma.
Okay.
Also, we check for refractive errors
Mm-hmm.
like myopia,
Okay.
hyperopia, and astigmatism.
Okay.
And then those who are aged 40 years or maybe in their early 35s may experience reading difficulty. Those people are the presbyopic group. We
Yeah.
call the condition presbyopia.
No, that's very
So
true.
once they see us as optometrists, we dispense prescription correction, which
Okay.
is in the form of glasses. Yes, so that we correct these conditions so that they can see well and appreciate vision for their class activities as students, or if they are workers for their work field, or
Okay.
if they are doctors, surgeons for their work field. Very important,
Yeah.
because without good vision, work productivity is affected and
Yeah.
efficiency is also affected.
That's very
Yes.
true. Wow, you said so many things about this noble profession, from vision correction to diseases related to the eye management, and I also want to ask you something about patient education. As an optometrist, how do you educate your clients on maintaining good eye health?
Yeah, excellent. I love this question. Yes. So, maintaining good eye health.
Yeah.
Yes, it's a holistic effort to
Okay.
maintain good eye health. One thing I always recommend over the last 10 years of my practice to my client or patient is that examination should be done per the situation or age group. For example, for babies, I recommend that babies are examined right in the first 3 months
Okay.
after birth. In the
Okay.
first 3 months. Why?
Okay.
Because there may be some latent conditions that, if without consultation with optometrists, may not be unraveled or may
Yeah,
not be revealed.
that's true.
Okay, so once we check them at within the first 3 months, it helps us to avoid some developmental conditions which would have caused them. For
Okay.
example, some of these strabismus or
Okay.
heterotropia can be detected early, and we can incorporate vision therapy so that we can help some of these people in the critical age group from
Okay.
birth to 10 years of age. And then for the youth and adult, I recommend that they examine their eye once a year.
Okay.
Once a year is key,
Okay.
because once a year it helps us to monitor your IOPs, because there are seasons and times where you visit us as optometrists who examine your eye and realize that the pressure is normal,
Okay.
but there may be a year that the pressure may increase,
Yeah.
and we may be able to help you earlier. It's called timely intervention,
Okay.
because when the pressure goes overboard, leading to glaucoma or glaucomatous damage, the person can go blind.
Wow.
So visiting optometrist once a year is recommended as part
Okay.
of good eye health or hygiene related practice.
Okay.
Yes. Also, we shouldn't be touching our eyes with dirty hands. Some people
Okay.
may visit the washroom or the White House or do some kind of work one way or the other and make the hand dusty, and they may not even use. They may not wash their hands before touching the eye, and that can transfer infection to the eye.
Yeah, that's
There are
true.
carpenters who may do their nailing or welding work, fitters who may do
Okay.
their welding work without protective goggles.
Okay.
So one of the ways to handle your eye health well, or your eyes very well, is that whenever you're doing any work that involves nailing or welding,
Okay.
that will spill anything. Maybe even those who wash,
Okay.
those who are into laundry,
Okay.
you need to wear protective goggles,
Okay.
because these protective goggles will prevent any damage.
Okay.
We call it trauma,
Yeah.
ocular traumas from happening, or if we can avert these traumas that we usually see in our daily life.
Yeah.
Every now and then I see welders coming to my clinic with metal pieces in their cornea,
Oh wow.
and this leads sometimes to corneal scarring
Yeah.
and loss of vision unless they go for corneal transplant.
Okay.
So I believe that maintaining good visual health or protecting your eye is a holistic effort. There's
Oh
a lot
wow.
of things involved.
Okay.
Yes, even computer protection
Oh
are
wow.
available. Yes.
Okay, that's interesting. So, speaking of newborn babies, what do you have to tell the Ghana Health Service and Ghana Education Service?
Thank you very much. I believe that A collaboration between Ghana Education Service and Ghana Health Service is going to help a lot in this area.
Okay.
We currently have the DVLA program, which is helping Ghana a lot because I wrote an article on that and I sent it to LinkedIn about
Okay.
reducing mortality rate
Okay.
through eye health or comprehensive eye examination.
Okay.
Currently, the DVLA, in partnership with GOA, Ghana Optometric Association,
Okay.
now organizes visual screening for
Okay.
everyone who wants to drive.
Okay.
And I believe that is going to go a long way to save many people from road accidents,
Yeah.
actually,
Yeah.
because with this comprehensive examination, detection of people with advanced glaucoma who were driving these truck car or Troskis, causing accident,
Yeah.
killing
That's
people
true.
is
That's
going to
true.
reduce
Yeah.
gradually.
Yeah.
So, in with respect to that, with children, if Ghana Health Service, in partnership with Ghana Education Service, organizes a screening for children before they start school, preschool children or children going to kindergarten or primary one, if there
Okay.
is a structure for them, then it will help them to avert some of these strabismus
That's
and
true.
look me problems or any challenge with their visual health,
Yeah.
basically.
Yeah, that's
Yes.
true. Oh, that's amazing. Okay, so you spoke, so many things about this profession, meaning that the optometrists wear many hats in their profession, from vision correction to disease management to patient education. Thank you so much, Dr. Felix. And before we wrap up, what advice do you have for aspiring optometrists out there?
All right. As far as optometry, you should keep on learning because learning is the way forward. Learning is
Okay.
the way forward. Every now and then, there are new research findings and there are new engagement. Eye diseases are evolving and there are new things and new paradigms in ocular surface conditions,
Okay.
in glaucoma management, in low vision, and in vision therapy. There are a lot of involvement in various fields. So I believe that continuous learning is necessary and key, and passion for whatever we do is key. I believe that the eye, in terms of vision, cannot be underestimated because you need vision for almost everything you want to do.
Yeah.
You know, and now is good eye health or good eyesight. So I believe that we should be able to learn more to help in this area. The Bible says in Matthew 6:22 that the eye is the light of the body,
Yeah.
and if the eye is healthy, the whole body is healthy. So I believe that optometry is a very noble profession, and if we can keep on learning and impacting our generation, it will help the world at large, not just Ghana or Africa, but the world at large. Thank you very much.
Wow. Thank you so much, Dr. Felix, for joining us in this show and then sharing this valuable insight in the roles of optometrists. And then to my viewers, thank you so much for joining us in this show. Please don't forget to like, share, and subscribe to this video for more eye care tips and informative content. Until then, take good care of your eyes. Bye.